Tonight, there are currently 1,600 people hospitalized with COVID-19 in Maryland. And for these people, it's not just about fighting the virus, but also the psychological effects that come along with it. WJZ is live at Johns Hopkins tonight. Sean Stryker with more insight on what they're going through. Sean.
Yeah, Rick, I'm sure you can imagine being hooked to a ventilator or just having difficulty breathing can cause a lot of anxiety and stress. Luckily, there is a team of doctors and therapists here at Johns Hopkins Hospital designed to help these patients. The physical ailments that accompany COVID-19 have been well documented. Fever, dry cough, difficulty breathing. Some of the lesser known symptoms are psychological and are a reality for some of the most critical patients.
From a psychological perspective, being on a ventilator is a pretty big challenge.
Clinical psychologist Dr. Megan Hosey works with these patients in the ICU at Johns Hopkins Hospital.
My role is in the intensive care unit to take care of the psychological health of our critically ill COVID patients.
Patients that are dealing with anxiety from having difficulty breathing and suffering from something known as ICU delirium.
It means difficulty kind of tracking where you are and what's happening to you. And in the worst case situations, patients tell us a little bit about hallucinations and delusions they experience.
Even after beating the disease, there can be remaining physical, mental, and emotional symptoms known as post-intensive care syndrome.
And then something sort of special about our COVID patients is they are telling us when they're headed home that they might be a little bit worried about things like COVID stigma. So fear of the loved ones and the people around them of becoming ill. And they're also afraid of infecting other people.
To help those recovering, Johns Hopkins has a new outpatient clinic specifically for COVID patients.
Is it a scary situation? Absolutely. Are there ways people can recover? Absolutely.
Now it's believed that post-intensive care syndrome affects up to 70% of patients that recover from a critical illness. Reporting live outside Johns Hopkins Hospital, Sean Stryker for WJZ.